Hey, Dr. Vicki here. So I want to talk about a new patient that I had this week, and it was interesting because she actually relocated here from a different state, and she just finished school. She's an engineer, and she is currently looking for a job. Was seeing a chiropractor back in Ohio, where she is from, and going to school. And so she has had this persistent neck, shoulder pain, and upper back pain, some lower back issues, and had been getting adjusted a couple times a week, and it was getting a little bit better. And she'd been going to the same person for quite a number of years. And so she'd go in for a quick adjustment, and then she would go back again for another quick adjustment. And so kind of going down the same pathway over and over and over again. And so when I was explaining to her kind of some of the things that I do in my office about active muscle activation is a big part of what I do for muscles that have been defacilitated, which means they're not firing at full capacity, which is a +5. So when you test muscle strength, it should be at a +5. Hers were mainly between a 4 and a 4.5. So in her neck, none of her muscles in her neck were firing at all. So that will tell you that, when we look at how much the head plays a role in loading that neck and shoulders, then that's a huge problem. So we got the muscles to relax once they were actually fully charged. And I use the laser to do the muscle activation. We did a lot of muscle work. We stripped the muscles with percussor, getting a lot of the lymphatic flow going out of her neck lymphatics, because a lot of stuff can get congested in through here. And she was having a hard time breathing. She had anxiety from all of the pain that she's had. And basically she saw my website and thought, this is a different approach, and I want to go try somebody different that uses laser therapy, because she had never had laser therapy except for pain management. So she walked out 80% better. Now we'll be seeing her again early part of the week, and so I have some expectations that some of those muscles will get fatigued and defacilitated just because of the daily activities that she's doing, because she's on the computer a lot. So she's sitting and she's looking at a screen. So a lot of stress on her neck. And we'll check her again on Tuesday, Wednesday next week, and see where she's at. But 80% better after one visit was something that she had not experienced previously with her other practitioners. So if this sounds like something that would be of interest to you or someone you know, give Souter Chiropractic a call. I can be reached at 303-385-3432 or souterchiropractic.com.